Hello, everybody. Good morning, afternoon, evening, depending upon where you live and where you're joining us from. We're happy to have you. Today, we are going to be talking about the new Congress and the new administration and what that means for end-of-life care and choice and options across the country. And we have some great folks with us. Um, it is, things are changing in the federal government and compassionate choices, and our full federal team has begun engaging with the 119th Congress and the new administration with continued determination and passion and to ensure that we're protecting patient rights, improving end-of-life care and access to medical aid in dying as an option for end-of-life care. I'm pleased to have with me three key members of our federal team who are going to help us navigate what is happening in Washington and how it will impact all of us across the country. Bernadette Nunley is JD. I always have to get that in, JD. She's CNC's National Director of Policy. She's going to give us some of the impacts that are happening. Thank you, Bernadette. Nelson Garcia, who is CNC's Director of Federal Affairs. He spends a lot of time in that building right behind his head, pounding the pavement of those hallways and sliding on the slick floors that I have fallen on at least one occasion. And Eduardo Soto, a principal at Rabin for government affairs and issue campaigns. Rabin is one of our firms that we work with across the country who provides counsel, advocacy, and lobbying on our behalf, and generally just smartness about what's going on in the political arena and also in the work that we're trying to accomplish in legislatures and with administrations. Okay, so I do want to just say from the get-go, we don't have the chat on today because we have a lot of territory to cover. If you have a question that you want to ask the panelists, we'll get to that at the end. But go ahead, there's a button that says Q&A on the bottom or on wherever your dashboard is. Click on that, you can put your question in and we'll try to get to it at the end of the program. If you have trouble, difficulty hearing what we're saying, you can use closed captioning. Which is also a button on the bottom. And there's also Spanish language translation within the closed captioning that should be happening live as we're speaking. Just recognize that it's slightly behind in terms of the translation, but getting faster and faster every day. Okay, the three of you, we've got a lot of territory to cover. But before we get started, I wanted to remind you all and our audience and everybody that Compassionate Choices is a nonpartisan organization. And this webinar will provide nonpartisan analysis of where our priorities lie in the 119th Congress and Trump administration. And so we want to make sure that we're representing the interest of all people. And most all folks have an interest in how they may die in this country. And so that is a nonpartisan affair. And we want to make sure that we're trying to engage with everybody as we are moving forward legislation and also as we are moving forward in this discussion. So Bernadette, we're going to start with you. Listen, as I traveled around the country before the elections up till the 20th, all the talk was about Project 2025 and what it was going to mean for healthcare and life care in particular. For those of you who don't remember, Project 2025 is the agenda proposed by the Heritage Foundation. And while the Trump administration has disavowed, or President Trump has disavowed Project 2025, many of its contributors are now being put into place within the Trump administration and have won elections into the legislature. It would denounce medical aid in dying, claiming it's not true health care, despite decades of evidence to the contrary, and threaten these options and their availability for terminally ill individuals who are seeking the peaceful death on their own terms. It would restrict access to essential care by restructuring federal agencies, and I bet you have something to say about that, and diminishing programs that support end-of-life care, especially for the elderly, disabled, and low-income communities, by adding barriers to Medicare and Medicaid. And then it will limit transparency and choice by controlling the discussions healthcare providers have with patients. potentially restricting travel for care, which for medical aid and dying is an important issue for us, and allowing providers to deny services based on ideological beliefs, regardless of patient values or medical best practice. Hey, Bernadette, in the opening
Hello.
flurry and daily issuance of executive orders, what's going on? What do you see?
Yeah, absolutely. Thank you. So far, the new administration is following the Project 2025 playbook. They've started with two major changes. There's the regulatory freeze, and they've begun, like you said, the federal agencies restructuring. I'm going to talk about both. The regulatory freeze started on January 20th on Inauguration Day, and we're still monitoring exactly what the freeze entails. So far, what we can tell is that any pending rules are being reviewed, and none of the new rules that were in the works will be proposed until appointees from the new administration review them. Rulemaking within these regulatory processes, they've historically been a place where Compassion and Choices sees a lot of success when it comes to our efforts to expand and protect end-of-life healthcare options. We track several agencies. Among them are the Department of Health and Human Services, which is huge, the Centers for Medicare and Medicaid Services, the Food and Drug Administration, or the FDA, and the Drug Enforcement Agency, the DEA. All of these agencies are being very closely scrutinized by the new administration. The positive view is that the new administration is getting their ducks in a row, sorting out what's been happening before moving forward. And I think the major challenge is that there's a lot of change, and that can be really disruptive as far as what we would usually expect to happen. This is an interesting area. I think we don't typically see regulations and administrative action as very exciting, but these processes are really fundamental. They tend to be slow. There's a lot of back and forth with rulemaking and public comment. The regulatory language itself is really dense, but this is where a lot of what happens in the issues we care about. So when Compassion and Choices submits a comment during rulemaking, or we request agency attention to a matter, we're highlighting how important federal supports and legal protections are for people at the end of life. Our federal laws support some really incredible resources for people at the end of life, and we as a nation are extremely dependent on the related health care. This is an area that's very much worth protecting, and it's a crucial area for our policy development, leadership, and advocacy. Mickey, you mentioned the Project 2025 goals to restructure federal agencies. I think this has been all over the news, so I'm sure a lot of people are tracking this. But some might not see these restructures as a big deal, but they're a really big change. Just like with the freeze, the new administration started restructuring on Inauguration Day by issuing an executive order to review senior career executives' performance. So these are the folks at the top of these agencies. New hires with expected start dates are seeing those jobs terminated. Diversity, equity, inclusion, and equity action plans and people serving to enact those plans, they're seeing their jobs terminated. We have department and agency leaders have been directed to end remote work arrangements. There are some more positive here. There are some carve-outs for Medicare and veterans programs, and we know that that's really important to our supporters. Federal agencies are an essential part of the healthcare system that leads to predictability and reliable healthcare services. Any restructuring and staff reductions may dramatically impact the healthcare services people at the end of life rely on. Even if the staffing changes don't directly target end-of-life services, healthcare delivery is a very interconnected realm, and impacts in some parts of the healthcare delivery system may inadvertently make getting healthcare services at the end of life more challenging. Like you said, new changes are popping up every day, and we're continually working on interpreting how they impact our movement and what we can do proactively and in response.
Wow. It's so interesting. I mean, like the idea that so much that healthcare law really kind of resides in the states. But healthcare regulation, particularly how money gets spent and who is qualified to get money in order to provide that care, the federal government has such a big thumbprint in that piece, and that can completely change what might happen in the entire system of care as a result of a shift in just that regulation and that criteria for who's eligible to get it. Um, we're going to turn our attention to Capitol Hill. I know you're going to talk about regulation a little bit more, or at least one or two pieces a little bit further down. But we're going to talk about Capitol Hill in our legislative agenda. Now, I'm going to ask Nelson to give a brief summary of each bill, and Bernadette to tell us the impact of you all as our supporters might feel if we are successful in passing that legislation. And then Eduardo is going to talk about like what it's going to look like to get it passed, if we can get it passed, what that will look like, not and the situation that that bill faces, particularly with the new Congress. But before we do that, Eduardo, I'm wondering if you have some general kind of prognosis. Like most of us aren't in DC living, we're getting our news from different news feeds about what's happening in Congress. I'm wondering if you could give us some general prognosis of like what to expect from this Congress.
Happy to do so, Mickey, and thank you so much. I've been such a fan of this organization, and I've had the privilege of working with Compassion and Choice's federal team for about 9 years now. So this is a major aspect of my life's work, and I feel so deeply about these issues. And listen, when it comes to medical aid and dying, let's start at the leadership level in Congress, right? Speaker Mike Johnson set the tone very early on because he became Speaker shortly after, or was reelected as Speaker, rather, shortly after the United Kingdom passed its own medical aid and dying law. And his response was to denounce it, right? To denounce the UK law, and he vowed to fight back. That said, we have to keep in mind that he does not speak for every single member of Congress, not even for every Republican in Congress. So we got to be prepared for a potential fight. And also keep in mind that he has very limited options available to him at the federal level, especially with the narrow, razor thin majority that he's working with in the House of Representatives. Also, we know that the people are with us, right? In poll after poll and across party lines, we have seen majority support for giving terminally ill patients the option to peacefully end their suffering. And when it comes to defending those duly enacted state medical aid and dying laws, there are so many conservative and constitutionally important arguments that Republicans can get behind. So, under this Republican majority, for example, this is an issue that we can present not only as a states' rights issue, but a federalism issue. And by that, I mean that even opponents of medical aid and dying at the federal level, they have to acknowledge that states have to have the ability to set their own rules and laws when it comes to these issues, and to do so without federal overreach, right? Something that Republicans in Congress have decried in so many other contexts. So there is broad support for the notion that not every issue requires one standard national standard, right? Or a one size fits all approach.
And,
When it comes to
Eduardo,
the
I think what you're saying, also, I don't want you to lose that thought, but before you go on to something else, I do want to just remind everybody that that popular support not only transcends political lines, but theological lines, through, demographic lines, through income lines. Like, we enjoy more support for the issue of medical aid and dying that, I mean, it is the kind of support that politicians would love to have for their own candidacies, right? So like I think that's something that is important to note, that there had been some who had thought that that the speaker's position might also be based on theological belief or thoughts or things like that. But just a reminder that he doesn't represent the entirety of that community either. Right?
Absolutely, he would find a varying difference of opinion among his congregation, among his fellow believers, because that is what the public polling and public opinion research shows us time and again. And when he tries to advance an agenda that may or may not affect healthcare at the end of life and medical aid in dying, Here's what that's going to look like. They're going to try and accomplish as much of that. They were just in Mar-a-Lago meeting to discuss their approach to this legislative process, but they're going to use a process known as budget reconciliation. That's not to put anybody to sleep, right? But it's as the name suggests, it's a process that is very restricted to pluses and minuses in terms of federal spending. That doesn't mean that it's not consequential. It can be hugely consequential because it matters how we spend federal dollars. And more importantly, sometimes it matters where we withhold federal funding, what we block funding from going toward. So you cannot make new law or change policy per se through budget reconciliation. Uh, and it is possible to advance some common sense bipartisan legislation, but there are strict requirements for what can be included in that process. So, for example, CNC has looked at legislation like the Lowering Costs for Caregivers Act, which would allow tax-favored accounts like health savings accounts to be used to cover caregiving expenses. There are other similar proposals endorsed by many other organizations that would allow for tax deductions or tax credits for those caregiving expenses. And you look at the emergence of what we have come to know as the sandwich generation, people who are caring both for their aging parents and for their children. The support for caregivers crosses party lines, and it's a bipartisan priority that we hope, in terms of lowering costs for caregivers, can advance through this process. Another vehicle that we got to keep in mind outside of budget reconciliation is the federal funding process, what is also known as appropriations. The bill that Congress passed in December at the very last minute to avoid a government shutdown, it included a provision to extend the use of telemedicine to certify eligibility for hospice care. A significant victory, right? That is one of those common sense policy proposals that benefits everybody, but particularly benefits those in rural communities who are pretty far removed from their nearest medical providers. And then last but not least, Mickey, I want to talk about cabinet appointments and how that may inform those regulatory concerns that Bernadette was referring to earlier. So just today, we had Robert F. Kennedy Jr. testifying in Congress in connection with his nomination to be Secretary of Health and Human Services. And in recent interviews, he's avoided taking a firm position on medical aid in dying, but he has left the door open to that. So to the extent that he is going to advance and become the head of this important agency, we want to make sure that he and his team are well briefed, well informed, that folks in key positions at HHS are well informed. And that includes other nominees like TV personality and former Senate candidate Dr. Oz. He was nominated to lead the Centers on Medicare and Medicaid Services, which Bernadette named earlier as a critical agency for end-of-life care. And some of the longtime supporters of Compassionate Choices may recall that Dr. Oz, in his televised, career, has had some involvement with the issue. He had a high-profile interview with Brittany Menard's mother about the issue of medical aid in dying, but that still does not tell us what sort of position he holds, and if it's a strongly held conviction when it comes to this issue. Last but not least, when it comes to cabinet and personnel, we're looking at President Trump's choice to lead the Drug Enforcement Administration. And we can say that the person nominated for that role, Derek Maltz, is a pretty typical choice, no matter what kind of party is in charge, whether it's a Democrat or Republican. This is a career special agent of the DEA with a strong stance against drug trafficking. And he's generally hostile to allowing new drugs onto the market, distribution of drugs that are not already in the market. He has some more moderate positions, like he's expressed some openness to marijuana reform, right? And so that's an interesting pick that we will keep an eye on and did not raise any flags for us so far.
Great. Thank you, Eduardo. I'm reminded about Dr. Oz. For a number of years after the Britney story, and Britney's mother appearing, Compassionate Choices was actually their special expert. So we were on their website and their resource facilities to answer all of their questions around end of life care, for the viewers, etc. So it's kind of an interesting connection. Hopefully, that might mean something more. We hope. We'll have to see and look back on how that went. We're gonna go to a discussion of the legislation, but before we go there, Bernadette, you said something which was about there might be a carve out for Medicare and VA. Can you give me a couple of more sentences on that?
Absolutely, sure. So by carve-outs, I mean that those programs are not affected by that particular executive order. So when we're talking about some of the hiring freezes and the restructuring, if Medicare is carved out, that means that people who are working within Medicare are not part of that executive order, so they won't be impacted. We're seeing that in lots of the different executive orders where they're intended to be targeting certain programs and certain issues. And so that means that some of the agencies and their staffs are not impacted, or the programs that they're funding are not impacted.
Yeah. Thank you for that. Okay, we're gonna go, Nelson, get ready. I'm coming to you. And we're gonna start with medical aid and dying. But again, I'm looking at the quick Q&A while I'm doing all of this because I'm multitasking. And I just want to remind folks that the Compassionate Choices efforts around passing authorization of medical aid and dying primarily and almost always, if it's legislative, is happening at the state level in state capitals. In fact, we were just at hearings in Delaware today. Our team was at a hearing in New Hampshire today. It passed out of committee in Delaware, its first committee in Delaware, and it's going to go to the floor. So that happens at a state level, and that's what we mean by often healthcare law happens at the state level. However, Compassionate Choices has a vested interest in federal law, both for medical aid and dying, as well as for other areas, which we're going to cover right now as we go through the legislative list. So let's just kind of clear that up a little bit in terms of, yes, you're right, questioner. But let's talk about, medical aid and dying. And Nelson, you're going to talk to us about the one exception where the federal government has play at the local level. Go ahead. Let's get started. Medical aid and dying.
That's right. Thank you so much, Mickey, for this opportunity to discuss our legislation on the federal level that impacts medical aid and dying. And yes, there are two medical bills out there right now that we are currently monitoring and pursuing to make sure that it's on the best interest of our constituencies. But first and foremost, rest assured to our audience that Compassionate Choices will continue to have a very proactive force on the Hill, educating, protecting, and hopefully advancing some of our issues during these challenging times. A quick note, the House currently has 65 plus new members, and on the Senate, 10 plus new members that we will be reaching out to. Some of these folks may be very supportive of medical aid and dying that we are not yet aware of. So it's definitely our mission, at least in the beginning of this term, to reach out to these offices and try to make sure that they're educated and well informed as we move forward. So first, Compassionate Choices will continue to fight hard against the very real attempts to repeal DC's Death with Dignity law under the Financial Services and General Government Appropriations Bill, which is the main vehicle and it has jurisdiction over DC's law. Though this will be fought in a very challenging environment, we still hope that the House, with a reduced GOP majority, will fail to pass its version of the bill, which last year was filled with very controversial policy riders that did not receive enough support among House Republicans. And as Eduardo stated earlier, the margin of the majority margin this time around is actually a little bit less than what it was before. So we're hopeful of that. The Patient Access to End of Life Care Act. This is our number one priority legislation in the 119th Congress. Was and will be sponsored by Congresswoman Brittany Pedersen of Colorado. It is our number one priority. The bill would exempt current and future states and jurisdictions that have authorized medical aid and dying from the provisions of what is known as the Assisted Suicide Funding Restriction Act, or the short version of it is ASFRA. Currently, ASFRA prohibits the use of federal funds to pay for the end-of-life care option of medical aid and dying for mentally capable, terminally ill adults. The bill provides that state-authorized healthcare programs and federally qualified health centers offering medical aid in dying as an option for terminally ill adults to peacefully end their unbearable suffering are not barred from receiving federal funding or assistance for these services. So CNC is in the process of working with the Congresswoman in securing additional original co-sponsors prior to the reintroduction this year. As a matter of fact, we just had a call this afternoon on that very same subject. And the good news is that we are all basically on the same page, and we have a very full understanding of what needs to be done over the next first quarter of this year.
Thanks, Nelson. I will say also, we have experienced at Compassion and Choices times when we believe when we've tried to engage in work that was not about medical aid and dying, that would have been eligible for like National Institutes of Health or other government funding, not being able to participate in those panels or not being able to participate in things as a result of what we believe to have been the implementation of ASFRA. So it's a very real thing, and it does block us. I'm wondering, Bernadette, if you have anything more to say about that, or should we go to Eduardo?
Yeah, I think you said it really well. Let's pop over to Eduardo.
Oh my gosh, I took it. Okay, sorry about that. Eduardo,
Well,
what do you have to say about medical aid and dying in
you,
ASFRA?
you hit the nail on the head, Mickey. Bernadette, is right to give you the kudos there. I will say, ASFRA is probably the most comprehensive law currently in the books at the federal level that restricts funding for any specific use or context. And of course, it misunderstands entirely what medical aid in dying is by conflating it with assisted suicide, right? So we're looking at this law from 1997, a very different era where there was a lot of misunderstanding and misapprehension about what medical aid in dying was, and we're turning every stone to find support for carving out that massive funding restriction law, right? We know that there is Republican opposition to this law, right? Representative Newhouse of Washington, for example, he voted to defend the medical aid in dying law in DC when he was taking a vote on that in the Appropriations Committee. He and another Republican, who is unfortunately no longer in Congress, crossed party lines to defend that law. We understand because not just the state of Washington's support for the law and having an authorized medical aid in dying law, but also because of familial experiences, which often shape our views, political and otherwise, when it comes to end-of-life care. So, and to continue defending the DC Debt with Dignity Act, while we also chip away at ASFRA, we're going to be working with the delegate of DC, Eleanor Holmes Norton, to mobilize folks who are already with us, but also representatives from Maryland and Virginia, right? Who see their neighbors in DC as equals who are, being subjected to federal overreach, right? So we will work with representatives from these states and with all of the supporters we have in Congress to defend medical aid in dying. And that's going to include, actually, I'm excited to say, some retired lawmakers who, because of the medical experience they have themselves experienced, they have been on the record in support of medical aid in dying in their own states. So stay tuned for that.
Wow. Thanks, Eduardo. I mean, every year we have to defend DC, right? It's always a potential for, some sort of appropriations battle to undo it. Similarly to Montana, every 2 years we have to protect Montana. And we're in that horrible fight again in Montana. And just as a reminder, in February, we'll do our regular every 2-month legislative update around medical aid and dying in the states with our A&O team. So make sure you keep an eye out for the invitation to that webinar where we'll talk about the individual states and the campaigns and what's happening in each of those states. But for now, we're actually going to move on to improving care and advanced care planning. And so, Nelson, I'm going to give it back to you to take a look at what's the legislation going on around improving care.
And specifically accessing to telemedicine. And before I proceed,
Yeah.
I want to go ahead and acknowledge my colleague, Bernadette. Between her and myself, we've been covering this issue on a variety of levels, whereas I'm handling it on the legislative side. She's obviously handling it on the regulatory side. And we've been very productive in making sure that our issues are being covered at both levels of the process. So it's true. With regards to telemedicine, Congress passed late last year a continuing resolution that extends the telemedicine deadline until March 14, which is coming up. We currently do not know yet at this time how long the next extension will be. Even though the Connect for Health Act, for example, sponsored by Senator Brian Schatz, a Democrat from Hawaii, and Representative Mike Thompson, Democrat of California, which expands Medicare coverage of telehealth services, makes permanent telehealth flexibilities that were enacted during COVID, and also makes it easier for patients to connect with their doctors and helps improve health outcomes. Unfortunately, that bill failed to make it to the floor of the House for a final vote. However, having said that, CNC will continue to work for its reintroduction, along with similar type bills in the 119th Congress. And I will have to say that it is a bipartisan supported effort. Both Republicans and Democrats see the value of telemedicine. There are just some issues that needs to be worked out, but I'm optimistic personally that this will eventually become a permanent fixture. Again, it's just a question of the regulatory process matching up with the legislative process, and hope to have something done in the next Congress.
Cool. Do you, Bernadette, do you want to talk a little bit about telehealth?
Yeah, I can pick up a little bit of the administrative and regulatory side. I too see telehealth as a really hopeful area for us because so many members of Congress and the new administration are generally supportive of access to healthcare through telehealth. We're really focused and concerned about medication prescribing that's needed for palliative care and during hospice. And we already know telemedicine is essential for people living in healthcare deserts. And those healthcare deserts are increasingly larger. And so more and more people throughout the nation are living in places where it's really difficult to get access to healthcare. And of course, at the end of life, very difficult. Another area that we're tracking and working on relates to the payment structures and the financing for telehealth. We need those provider payment structures to be adequate to sustain the services. So, for example, there have been some efforts to reduce payment to providers for telehealth services so that someone who's offering in-person services might be paid more than the provider who's providing those services through telehealth. But we know that that system might not work, and that financing is being looked at really closely. And then the other area that we're tracking and contributing to is through the Drug Enforcement Agency, or the DEA. They released a proposed rule on January 15th, and comments are due in March. This proposed rule includes a special registration for prescribing controlled substances when a provider has not had a face-to-face visit with a patient. And we know with hospice, there might be some providers and part of the healthcare team who are in person with the patient who is on hospice, but it's not always the prescribing physician or prescribing provider who has that face-to-face visit. And this special registration could be somewhat of a hurdle. So we're tracking that. We really know that end-of-life care needs are recognized in the proposed rule, but the path to protect these patients isn't totally clear. So we're going to provide a comment for this rule.
Right.
That is also, Mickey, a major aspect of the Compassionate Care Act that CNC has championed over the years and that Nelson is going to elaborate on next. There are provisions in that bill that would take those telehealth flexibilities, particularly for recertifying eligibility for hospice, and make those permanent, right? So that we're not just trying to extend these on a short-term basis as we have been doing recently.
That's right, Eduardo. And there are two priority pieces of legislation that will improve care. And that includes, as Eduardo mentioned, the Compassionate Care Act, or CCA for short. This bill was actually introduced in both the House and the Senate. On the Senate side, it was introduced by Senator Richard Blumenthal Democrat of Connecticut, and Representative Nanette Balagan, Democrat of California, in their respective chambers. And the bill would promote advanced care planning through national strategies, including physician assistant education and public awareness campaigns, and addresses hospice Medicare coverage limitations. Now, we are looking at elements of another related piece of legislation known as the Improved Access to Advanced Care Planning Act, which received Republican support in the past to complement CCA in order to make the overall bill a more bipartisan effort and increase its chances of passage in a GOP-controlled Congress. So the Improved Access to Advanced Care Planning Act would expand providers that can bill Medicare for coverage of advanced care planning services to include clinical social workers. Other priority legislation that CNC will be working on include the Health Equity and Accountability Act. This was a bill sponsored by Senator Mazie Hirono, Democrat of Hawaii. And then the House counterpart was introduced by then Congresswoman Barbara Lee, Democrat of California, who has left the Hill. But both bills seek to ensure communities who face health inequities that they receive the health services they need. In that bill, Compassionate Choices successfully advocated for the bill sponsor to ensure that end-of-life care was addressed.
Yeah.
And I can add that for the Compassionate Care Act, what we're really focusing on is we want to make sure that people have the support that they need to complete their advanced care planning documents and to go through that process. There's another related effort that we're working on to ensure that when people do complete their advanced care planning documents, that those documents are added to their electronic health records, and that those records, those documents are made available regardless of where an individual is receiving care. There's continuing development in this realm. And then to pop back to the Health Equity and Accountability Act, it's really an enormous bill, and it covers lots of different policy issues and efforts. And we've successfully extended its focus to include the end of life, which is huge.
Wow, and I just for our supporters, I mean, when I'm with supporters, this is like one of the things that is of most interest for folks who are concerned about being transferred to the emergency department and that their advanced care planning documents, their DNRs, don't go with them, or they end up in an emergency department and they're not readily available, and then they end up, with incredibly invasive treatments and or in the ICU if that's counterindicated in their advance directive. So there's real life repercussions for this. And the other side is true too, like fear that people might not be transported to the hospital who want to be transported to the hospital because there's not clarity around the advanced care directives and portability around those. So super important stuff. What do you have to say about the Compassionate Care Act, Eduardo?
Well, as you were pointing out, Mickey, this is a universal experience, right? With so much support out there, particularly when people have themselves been through the process of not having their wishes as patients honored, right? Or having the wishes and preferences of their loved ones disregarded in medical settings. So we know that there is much more support out there that we could be recruiting. So in addition to the efforts that Nelson and Bernadette just described, we're going to be expanding our outreach to other organizations that may seem obvious or may seem totally unconventional as allies, right? But they have endorsed related legislation, right? Legislation regarding hospice care, palliative care, other aspects of end-of-life care, but also telehealth and advanced care planning. And we think that by building a broader base of support and working in coalition with these folks, we can have the stronger case, not just for bipartisan support, but for getting these bills through even a difficult Congress like this.
Yeah, wow. That's a big job, but we don't really know where the support is without looking at like all of these different little pockets of places in the federal government, right? Like it's not always completely obvious where the support's going to come from. And I think we find that in the legislative process around medical aid and dying, around hospice, palliative care, all of those places. You never absolutely know where it's going to come from. So thank you for checking under every stone for us around those pieces. Nelson, we've got like, I guess the last pair of efforts that are around I guess mostly targeted towards the workforce, right? Like improving the workforce in some of the places that we've talked about, like hospice and medical care.
That is correct, Mickey. And I want to mention a couple of bills that we are also following in this Congress. The first one is the bipartisan Palliative Care and Hospice Education and Training Act, better known as PACHETA. And you have to understand, here in Washington, we prefer a condensed acronym for a lot of these bills. So it just makes it easier for us to talk about it. So PACHETA, which is sponsored by Senator Tammy Baldwin, Democrat from Wisconsin, would increase the number of faculty at accredited palliative care schools and expands education for professionals to better prepare them to care for people at the end of life. We are also working on the VA clinician appreciation, recruitment, education, expansion, and retention support, better known as the VA Careers Act, sponsored by then Senator John Tester, who was defeated in the last election cycle. And so we are obviously looking for a new sponsor of the bill. But the bill improves the hiring, training, and retention of Veterans Administration healthcare personnel, including healthcare staff who serve older veterans and veterans at the end of life. Like I said, we will look at a new sponsor for this, but this is a bill that received bipartisan support in the last Congress, so we're very optimistic that we can do so again as well.
That's correct. And we're hearing from other organizations in this space, other advocates in this space, and experts, subject matter experts, that there's an urgent need to address these workforce matters, right? So it's great to be able to say that legislation like PACHETA and the VA Careers Act have received strong bipartisan support over the years, even if they have fallen short of passing on the recent legislatures. We have a unified Congress and a White House of the same party this year. We'll have to see what kind of appetite they have for bipartisan legislation, but there's no denying that these matters are long overdue. These legislation are long overdue, and there should be a chance to move these forward. So I'll say, for example, to give us a little bit of an optimistic note, current congressional leaders have expressed interest in getting much of their agenda enacted through a party line process. But that is such a restrictive process that a lot's going to be left on the cutting room floor. And let's see how much of that, could advance some of these same goals, and we can get done on a bipartisan as opposed to party line fashion.
Thanks for that reference during this period of time of the Oscar nominations to film editing. We appreciate that. Bernadette, what do you think?
Yeah, I mean, I think I'm excited to continue working on both of these bills. As both Nelson and Eduardo are saying, healthcare staff need good training to understand patients' needs when they're seriously ill and at the end of life, and these two bills both help us get there. I do think I don't know if it's a prediction, but considering the new administration is talking about a focus on cost cutting, we might see more energy on end of life issues. We've recognized that for so long, most people want to be at home at the end of life and don't want to cycle in and out of emergency departments and hospitals receiving aggressive treatment. And we know that palliative care and hospice improve quality of life and help avoid this cycle. So I'm curious to see, the support and hope there's more energy there. And there's one other area that I want to make sure we mention today because it's very important and another one that we're tracking, but that is home care staffing and long-term care staffing ratios. We've had a crisis in long-term care settings for quite some time, and they're often understaffed, which can mean that people who are residents there or patients aren't able to receive adequate care. People at the end of life might be particularly vulnerable considering the need for supportive care. During the last administration, there was support for increasing staffing ratios, and we are concerned that those ratio requirements might be rolled back. So that's another area that we're again tracking to make sure that people receive the care that they need.
So I want to stay on this subject for a second. Thank you all three. And I'm basically looking at some of the questions that we have. But before I kind of do a general answer to a lot of them, one specifically got my attention, which was, we've heard a lot, there's been a lot in the news lately about the quality of hospice care. and the significant shift in hospice, the private investment in hospice. And I mean, I think we've also seen, I was just recently reading my AARP advocacy bulletin about, the change in like doctor practices, all being kind of purchased and bought out by larger corporate chains and things like that. So I guess I'm more particular. I hear a lot more about hospice, and we've been seeing a lot about hospice and the potential of regulating hospice differently, or trying to set like what different codification around what good hospice looks like and things like that. Are we, these bills around workforce seem to be like they would improve hospice, but are there any other activities happening at the federal level, particularly in the regulatory environment, that would specifically impact hospice care, and in particular in-home hospice care, I guess? Any thoughts on that from you all, or heard anything?
I can pick that up. We are part of a coalition with the National Alliance for Care at Home, and so we're tracking, and that's an organization that includes a lot of hospice providers and palliative care providers. And in that coalition, we're tracking this area very closely. I would say with the private equity component that you brought up, the issue is less, well, there are some concerns there, but the real focus is on how do we understand what good hospice care is, and how do we set those standards, and how do we move forward regulations that are thoughtful and don't push small hospices out, so that, because those are important care providers too. And so we want to have balanced measures that have clear standards, that make sense, that are well tested, to get to some of those problematic issues that are coming up. We've heard a lot about fraud. So there's a lot of effort that's there, and we're at those tables.
Gotcha. Okay. Thanks for that. I do want to say there were a lot of questions here about kind of like understanding. I'm going to see if I can take care of a bunch of questions at the same time by giving people resources. So the first is, if you want to know more about what's happening in your state about medical aid in dying, the best thing to do is to go to the Compassion and Choices webpage, the compassionandchoices.org, all spelled out, or cnc.org, all spelled out. And scroll down halfway. You'll see a map of the United States. You click on your state. If your state has authorization, it'll give you information about how to access medical aid in dying. If it doesn't have authorization, it will share with you like where we are in the process of authorizing. There's also the state advocacy and action page, which gets updated weekly about what's happening in different states around authorization. So feel free to go there. Folks who are looking for bill numbers and federal bill numbers and things like that, our federal page, our federal legislation page, is updated by Nelson and his team on a regular place. And as soon as bills are reintroduced for this Congress, those bill numbers will be added to that page. But most of the bills have not been reintroduced yet in this new Congress. They're awaiting new bill numbers. So we don't have any to give you at the moment. And then finally, we will say that as we will be instituting this year more aggressively calls out to our supporters for participating in our federal campaigns around federal legislation. So some of you have wanted to know how you could get more involved in these pieces. So keep an eye on your email box. If you are not giving us your email address, go to the website and to your account, and log into your account and add your email address, which if you don't have one of those, just email info@compassionandchoices.org and send us a message about how you'd like your record updated, and we'll make sure that we get your email address in. At this point, if you registered for this webinar, your address has probably been updated if you use that to get to us this time. So I think I think that the one more piece that I'll just kind of redirect you to other resources is the chance of federal legislation to somehow undo, I think you touched on this, Eduardo, but to somehow undo what the state-based laws that have already been passed around medical aid and dying. Like, is that possible? What would that look like? What's the likelihood of something like that happening?
Well, it's a great question, Mickey, and I have to applaud the amazing efforts by CNC and its supporters to defend those laws when they come under attack at the state level. But when they're under attack at the federal level, it really matters whether we're looking at restrictions on funding, right, which are now very much in place, and you can hardly get any more strict than the Assisted Suicide Funding Restriction Act has already accomplished. And whether we're looking at a state or a jurisdiction that Congress has direct oversight here. And of course, that only applies to US territories, none of which have authorized medical aid in dying yet. But there's also the District of Columbia, which is under direct congressional control for purposes of repealing duly enacted laws at the district level, blocking funding for the implementation of those laws, which has a similar effect, and something that we saw for the first time last year, trying to salt the earth after repealing something like the DC Debt with Dignity Act and making it clear that the District of Columbia can no longer pass a similar law in the future. Right. So it's extremely important to defend against those attacks, because I'm sure that opponents could get very creative and try to build on something that is even as comprehensive as ASPRA.
Right. So, and ASPRA is kind of interesting because, I mean, in terms of the testing, the Peterson legislation is the first time we're really testing ASPRA for clarification, right? You know, like, so a lot of the reason why in medical aid and dying authorized states, like hospice would not participate when we're told, or when we hear about and or get legal complaints around hospice not participating in medical aid and dying, or palliative care units not participating, or assisted living facilities or things like that not participating in medical aid and dying. Sometimes it's around that ASPRA funding and the sense that that would cover this, right? Like, so in terms of the clarification, I guess, Bernadette, this may be a question for you. From a legal perspective, is there further places that we can go in terms of trying to get clarification beyond trying to say, look, this is where this doesn't apply to states that have authorized medical aid and dying, because the legislation carves that out as a states' rights kind of issue, right?
Mhm.
If
Yeah,
I,
yeah, the tact we've taken, or the strategy that we've taken with that particular issue, is to work more directly with hospice providers to give them the information to help them understand how the Assisted Suicide Funding Restriction Act works or doesn't work. And so it's providing information that at this point has been the best strategy for tackling that particular concern.
well, that, as well as like the work that we've done in states to try and work with those state administrations
Mhm.
to state Medicare and Medicaid, or state Medicaid
Yeah.
funding.
Absolutely, absolutely. And so that's a common question that comes up. You know, we are a federally qualified health center, for example. Most of those federally qualified health centers, they have some federal funding and some state funding. And so to help people understand, or those centers understand, that the state funding, when medical aid and dying is authorized, can be used for medical aid and dying, but there has to be clear separation between the federal funding and those funding streams. And so we work with providers in that capacity.
Yeah. There is a sense about, I mean, and I don't think we're looking at a situation around medical aid and dying beyond ASPRA, right? Like, probably we won't see the codification of legislation that would outlaw medical aid and dying. We do, however, we're keeping a very strong eye on it. This is one of the reasons why we are so diligently defending in court and participating in the defense of the California law, which is the one that's the most threatened, because could be issues within the court system. And for those of you who want to know more about that, our Bernadette and our legal folks will be back next month, I believe, to do the court analysis, which will include that analysis around medical aid and dying. So if you have a question around that, let's take that. Hey, listen, this is a question that stumped me, and I think it's because many questions stump me, but somebody mentioned in the question that the GOP 2024 party platform, the party's opposition to medical aid and dying and youth in Asia was removed. I mean, I know that the platform was removed for a while, but the opposition to medical aid and dying and youth in Asia is removed. Does anybody know whether that is an indication of perhaps the White House having a different opinion around medical aid and dying and youth in Asia?
Mickey, if I may, I think that has a lot more to do with the abortion language that they knew the Trump campaign knew they were going to get attacked on by the Democratic nominee, and therefore they wanted to minimize that by removing the language from the platform. And I think it was more specific to abortion and reproductive rights than it was to medical aid and dying as a whole. So they were able to successfully do that in protestations among the pro-life groups that complained about it. But at the end of the day, they backed down and allowed the platform to continue without such language in there. I will say this as well. Having participated in both Republican convention in the past, as well as working on the Hill for Republican members, they are two separate entities. Members of Congress don't necessarily refer to the party platform to help determine legislative priorities. And so even whether or not the language of medical aid and dying is in there, I would not necessarily be directly concerned that the party platform may have addressed medical aid and dying. I would be more concerned about what the Hill does with that issue than anything else. Because again, I will guarantee you members of Congress have not read the party platform, and the idea that they know exactly what the party platform says about a particular issue is something that I'm not sure about. So there's that.
Yeah. I just want to clean up one other thing, which is I think somebody I think somebody said with the passage of the UK's medical aid and dying legislation, just to be really clear, it passed the first vote. That did not pass the final vote, but generally in the UK, if you make it through the first vote, it is generally considered a sign of passage. So formally, no, it has not been officially adopted in that process. So we just want to make sure that that's there. I think that with that, we're gonna actually we're basically at time. I do want to thank our folks for participating. There is a lot about medical aid and dying in the questions. There's a lot of thinking and thoughts about that. Please, again, join us for the medical aid and dying legislative update and our court update, which will happen in February, which will give you more information. Again, on the federal level around ASFRA, check out the federal page around medical aid and dying. ASFRA, again, is the Assisted Suicide Funding Restriction Act. And the Peterson bill, what's that called, Nelson?
It's the Patient Access to End-of-Life Care Act,
which is the proactive bill to try and allow federal funds to be spent in the states where there is authorization for medical aid and dying. Please go to that page and go to the Advocacy in Action for weekly updates on that page of our website. And for state updates, click on your state in the map on the front page. Bernadette's team has this amazing legislative tracker that tracks all kinds of bills across the country and the state, which will soon, we believe, available online. So you can look at not only the status of a particular medical aid and dying authorization, but many of these federal bills and their associated bills that might be happening at the state level. So for our wonks who are on the Q&A feed, you'll be happy to learn about that when that becomes available. So with that, I'm going to thank Nelson, Eduardo, and Bernadette, Patrick, and Michael, and for all of you for your questions. Thank you very, very much, and we will see you next time. This was recorded, and you'll receive a version of the recording in an email as follow-up if you registered using your email address. Thank you all very much. Have a great rest of your day and a great week. Take care.